I'm Lauren Peña, and I'm a registered dietitian and a faculty member here at Purdue Global. It's important to speak to your primary care provider or consult a registered dietitian for a diet plan specifically for you. Many other factors need to be considered, including your medical history and medications. The nutrition guidance given is based on a general adult diet. National Nutrition Month first began in 1973 as National Nutrition Week. Kickoff activities included a presidential proclamation and public service announcements. The goal was, and still is, to teach nutrition education to the public. Then, in 1980, it grew even bigger and was formally recognized as a month-long observance by the Academy of Nutrition and Dietetics. This year's theme is Food Connects Us, and this theme encourages all of us to develop connections with our food and to learn more about developing healthy eating and physical activity habits. We all lead increasingly busy lives with our attention being pulled in so many different directions. You could be a college student juggling a job and a family, and maybe you didn't have time to wake up early and make yourself breakfast. You could be a working professional in an office, scrambling just to find a quick second in between meetings to eat your lunch. So when it comes to food, we tend to put it on the back burner. But eating food is an activity that we're doing every single day, multiple times a day. So while it is part of routine, we should take time this month to reflect on what we are fueling our bodies with to avoid health issues that may occur later on in life. We may not have control over our genetics, but we can control what we eat, what we drink, and how active we are. One of the biggest misconceptions regarding our nutrition is I need to give up all my favorite foods to lose weight. This is just not true. Sometimes it can be as simple as eating less of them portion-wise or less of them throughout the week instead of cutting them out entirely. Another thing to consider is how quickly do you consume your food? Have you ever tried putting the fork down after each bite? This will allow you to take time to enjoy your food and notice when your stomach is giving you those fullness cues. One of the biggest tips I can give is to become familiar with cooking at home. Now, I'm not saying dedicate your life to becoming the next five-star chef, but making some recipes with a few ingredients will be so valuable. It will help save money to cook at home, and it will allow you to better control what you're fueling your body with instead of relying on going out to eat. My two favorite pieces of cooking equipment are the crock pot or slow cooker and the air fryer. Not only are both affordable to have in your home kitchen, but the slow cooker and the air fryer are machines that are only time and temperature based. So you only need to remember to plug it into an outlet and push a button. Meals come together with not a lot of preparation, and the ingredients are typically seasonings, proteins, and vegetables. The second Wednesday of every March is Registered Dietitian Day. Consider making an appointment with a registered dietitian today at your local clinic or even virtually. Registered dietitians can help you by providing evidence-based nutrition advice for you and your family.